Video is to introduce you to Telehealth. Telehealth is a service that we provide to families who are unable to attend in-clinic appointments, which we have been using for quite some time. This service allows us to provide regular therapy to our clients despite the circumstance or the distance, and allows us to be flexible in the way we work with you. Telehealth is a growing area of practice, with many clinics around Australia and the world operating as online-only services, and the evidence base proves that this model can be just as effective as face-to-face appointments. All you will need to set up for these appointments is a computer or laptop with internet and a camera on it. If you don't have a computer or laptop, a tablet or a smartphone can work just as well too. These sessions are run using a program that we call Zoom. If technology is not your thing, that's completely okay. We provide our families with an easy to follow handout on how to set up your very first telehealth session. Essentially, your clinician will email you a link which allows you to join the session. We recommend that you allow yourself a bit of extra time before your very first session, about 10 minutes or so, for Zoom to get set up. Once you've used this a few times, you'll find it so quick and easy to join your child's appointment. And if all else fails, we're only a phone call away. Zoom is a fully functional virtual classroom, which allows us to share all the resources and materials that we would normally be using in person with you and your child. Zoom has a whiteboard with interactive tools, which allows your child to engage directly with the material, as well as screen sharing functionality so that you can see and hear what is happening on your clinician's screen. Telehealth sessions can look different depending on the age of your child. For our littlies, we need parents to be actively involved. As a parent, you are the expert on your child and your home situation. Telehealth allows us to bring our expertise right into your home. We can work with your child's favourite toys and activities and show you exactly how these can be used to help your child's learning. We can also support you with setting up your daily routines to maximise learning potential, such as meal times, organising toys and games, and even building more communication into routines like bath time and the dreaded nap time preparations. Not only does this mean that your sessions are tailored to your context, it makes it easier to continue your practice at home. You already know exactly what this looks like. For our preschool and school-aged kids, the good news here is that by this age, your kids are already developing those good sitting and listening skills. With more and more tech in children's learning environments, your child may have already had some technology input into their learning. For this age, we still need parents to be involved. However, this may be more of a supervision and support role to ensure that your child is getting the most out of their therapy session. Some of you may have concerns about your child attending for that long. We hear you. Attention can be difficult, especially when telehealth is new. But rest assured, we have the tools to manage this. The best part? Once we find the right tools for your child, these can then be used to support attention in other areas, such as the classroom, where they're doing home practice for speech at home, at story time, or even sitting still at the dinner table. Kids can be surprising and typically can be very driven by the novelty of sessions on the computer or the device. Telehealth can be a refreshing change for some of our clients, and sometimes even the parents who have been coming to speech for quite some time. Working on the therapy activities in your own home can also breathe some new life into your home practice, as we can model how practice can be completed at home. Telehealth is a highly flexible and easy to use alternative to clinic appointments, which is already being used countrywide to great effect. We look forward to working with you joining our virtual TalkHQ family. If there's anything we haven't covered, or if you still have some questions, check in with your speech pathologist, as they are the experts in using telehealth and we are all here to help you.